All the news about healthcare spending in the United States is overwhelming, and trying to make sense of it all is difficult. I've been doing a lot of reading on the subject recently, and I thought I'd make this video to share what I've learned so far with you. So, we're going to discuss US healthcare spending, the numbers that directly impact you, and 5 things that you can do about it. I'm going to start by talking about how much we spend each year in the United States on healthcare and comparing it to something that we all do commonly, shopping. Try and give it a little bit of context. In the US, we spend $3.2 trillion a year on healthcare services. That dwarfs what we spend each year shopping at places like Walmart, Target, and Amazon. And that's usually a lot more fun way to use our money. But what does it mean for you individually? Well, for children, the average cost of healthcare services per year is about $3,500. For adults over the age of 65, it's about $19,000 a year. But when you actually look at everyone together, the average is just under $10,000. Now, the actual cost on average for healthcare services for working age adults is about $6,600 a year. But that's not usually what we pay. Working adults often pay about $12,000 a year individually when you consider the amount of taxes, premiums, and out-of-pocket spending like deductibles when you actually have to use healthcare each year. Now, I get it. Working age adults are covering the cost for children who can't care for themselves, to help with taxes for the elderly who have already contributed, and of course for those in need. And I'm okay with spending a little bit extra, but in the United States, we don't just spend a little bit extra, we have to pay a lot extra. It has to do with the fact that our healthcare services are really expensive. But how much more expensive than other countries? Well, let's take a look at what that $9,990 a year average looks like compared to other industrialized countries. It's a lot more. In fact, it's almost double or triple what other countries spend per person on average on healthcare services. There are 3 unique reasons why the U.S. is so expensive. Number 1 is that we overutilize high-tech imaging studies like MRIs, CT scans, things like that. Number 2, we're obese. And number 3, our services for treatment are overpriced. Let's say you lean Republican and want to have the market control healthcare. Not a bad idea, but the people who use healthcare don't have any say in what the market prices are. Patients can't affect that change currently. Let's say you lean Democrat and have an interest in a single-payer system where the government controls healthcare. Also not a bad idea, but the government is not overall controlling the price of healthcare services. So what do you do then? Well, it isn't all doom and gloom. It just has to take a little bit of cultural change. And that's why I want to introduce these 5 things that you can do to help improve the healthcare system and potentially reduce the cost for you. Number 5, don't rush to high-tech testing. In our country, physicians and patients alike have adopted the behavior that by using high-tech testing, they'll be able to find the exact reason why you're in pain or have a certain ailment. The truth is, these tools have a low predictive value if your provider isn't already suspicious of an issue, and they're not really helpful unless you're planning to do something with the results, like surgical planning or changing a medication or some therapy. Otherwise, they're expensive, and they shouldn't be used just to double check and make sure nothing's there. Number 4, track your weight loss. This recommendation is focused on controlling obesity in our country. But if you're going to watch your weight every single day looking at the scale, it would drive you mad. Instead, what seems to be more effective is adopting a behavior that you know is predictive of weight loss and tracking that more frequently and intermittently checking on your weight loss. For example, tracking calories or graphing how many times you drink water in replacement of some carbonated drink. These small steps that we know are predictive of weight loss are a little easier to manage and less frustrating than not seeing the scale move. Over time, it will move. To help ensure that, track your change with a scorecard and keep yourself accountable with friends or some other group. Yes, some people do need a little extra support from medicines, surgeries, sometimes even psychological support, but the only way to keep the weight off is with a change in behavior, and hopefully this idea helps. Number 3, exercise regularly. This doesn't have anything to do with losing weight. This has something more to do with having an inexpensive way to treat your medical issues. Exercise is one of the best tools for treating chronic disease. Whether you have hypertension, diabetes, fibromyalgia, or depression, exercise alone or with other medical treatments is extremely successful. And it's free. Ask your doctor about the American College of Sports Medicine recommendations for exercise prescription. If you're going to exercise, you want to make sure you do the right amount and the right intensity to be useful. Number 2, journal your progress. Now, full disclosure, I'm starting a business where we sell journaling tools so patients can track their progress over time. But the reason we're doing that is because I have found that individuals who journal their medical visits and their progress between visits are more engaged in their health care, reduce expensive redundant treatments or evaluations, and overall have better outcomes. And then, number 1, don't be afraid to ask what it costs. After a non-emergent medical visit, make sure to ask your physician or other providers for CPT codes or HCPCS codes related to the procedures or durable medical equipment you may be asked to consider as a treatment in the future. Then you ask who's going to be billing for all those tools, because it isn't always the doctor's office. Sometimes the hospital bills, sometimes it's a third-party company that actually manages tools like crutches or braces. Once you have that information, you call your insurance company and you ask what the negotiated rates are. This is the amount that's split between you and the insurance company. This is going to be tedious. It may frustrate you to no end, but the sooner we start asking what we're going to have to pay, the sooner the sneaky way healthcare costs get inflated will be exposed.